Well, I would say that basically the effectiveness of either one is about the same. The difference is that with Mohs surgery, you actually do have a microscopic analysis that shows that the margins are negative. The radiation, we usually go with larger margins than you might need with the surgery. You see, with that Mohs surgery, you go with such fine margins as you're cutting through that you don't have to cut as much. With the radiation, we would treat a little bit larger area, but it's not invasive, so it's very well tolerated. And so it's a lot of it's a patient choice. The surgery it's fast. I mean, literally it's slow. It takes hours. But the idea is you only have one treatment and you feel psychologically that you've got it out. Radiation therapy takes a different type of mindset because it's multiple treatments and you're always wondering, did they really get it? How do you know you got it? I get this question about radiation for every part of the body that I treat. They say, Doc, how do you know you got it out? And it's really a clinical assessment. I try to explain to the patients that even with Mohs surgery, there is some recurrence, and therefore you have to follow the patient clinically anyway. So really, the only difference is that the doctor says, I got it out, but they may not really have gotten it all out, but as well as we can analyze it, it looks like the margins are totally negative. So the patients really have to be comfortable with a different type of mindset that, well, this is equally effective and it just takes more time. A lot of patients really just want to get it, they want to feel that they were told it's out. Even though it's no better, they just like that feeling. And of course, the downside of Mohs is that there tends to be much more scarring because it is an invasive treatment. Sometimes you need plastic surgery afterwards. And sometimes, of course, you need radiation afterwards anyway. And you could say, well, is it any better than if I would have just gotten radiation up front? Well, in those cases, really, it's about the same as getting radiation up front and not needing any of the surgery. So, you have to look at where your odds are. Nobody knows exactly where they fall within the statistics. I could tell you, well, it's amazing chances for success either way, and you'll say, okay, fine. You just do what you're more comfortable with. And then, of course, if you happen to be one of the small percentage of patients that needs a post-operative treatment or has a recurrence, then that's it. But there are no guarantees with any treatment. I always tell my patients, if you go to a doctor who tells you you've got a guarantee with the treatment, don't go to them because there are no guarantees.
Following up with radiation therapy, do they have to do a biopsy after radiation therapy to determine whether or not the cancer is gone?
That's very rare. Usually you can tell by clinically assessing, and it's only if you have a question and maybe it's increasing afterwards, if it's increasing afterwards, you know what's going on, you have a resistant tumor. But then you might do a biopsy to confirm it, or let's say a year later there's another bump that comes up that was in the treatment field, you want to check it, but usually you do not need a biopsy. And it's a clinical assessment, you just look at it just like the surgeon would look at it and follow up.
You were talking about like Mohs surgery. It's a long process of that day, isn't it? What is a day like when you're going in for Mohs surgery?
Usually, I'd say the patients are usually there for a good few hours, and they have. What happens is they get something cut, and then they have to wait for the microscopic analysis to see if the margins were negative were obtained, or if the doctor has to go back in. And it could be many hours, or it could be just a couple of hours, but often they have to come back for a closure, maybe the next day or the next week or something like that.
And or maybe cosmetic surgery.
That's right, yeah.
With radiation, one of the things people will say is, oh my gosh, I need 15 treatments. With Mohs, I can get it done in one day and be done with. How do you justify the difference?
Well, I tell them, I say, well, look, if you add up the number of hours you have to be there for Mohs surgery, and possibly needing a flap or a graft afterwards and coming in for your follow-ups, it's really not that different in total time because the radiation maybe takes 15 minutes. This is a very large area. It's going to take 15 minutes. Usually it takes less.